Attention seniors and disabled Americans. If you've been waiting for a surprise, this is it, because we finally have some very important updates that could completely change your benefits. If you receive Social Security, SSI, SSDI, veterans benefits, railroad retirement, or surviving spousal benefits, then this is a video you cannot afford to miss. Look at this. This could be the biggest Social Security surprise for retirees in 2026. Yes, you heard that right. A new development could be coming, and when we examine the data, the results are both surprising and disappointing. Look at this. The amount of the 2026 Social Security COLA shouldn't be surprising. Why? Because we already have July 2025 inflation numbers, and unfortunately, the figures are falling short of what retirees had hoped for. Seniors expected a much higher adjustment, but so far, the estimates are underwhelming. Look at this. Many retirees won't pocket the full Social Security increase because of higher Medicare Part B premiums. This is the part that stings the most. Even when benefits go up, rising healthcare costs often eat away at the increase, leaving little extra money in seniors' pockets. Retirees have several options that could help offset the increased Medicare Part B premiums. The $23,760 Social Security bonus, most retirees completely overlook ***. While few people talk about it, strategies and programs do exist that can help you keep more of your benefits if you know where to look. The reality of surprises tend to be less welcome the older you get. That's because they're often, although not always, of the negative variety. Will retirees be in store for surprises related to Social Security in 2026? Probably. One, in particular, could be the biggest surprise of all. And here's where the frustration begins. Seniors are already struggling to cover groceries, rent, and medical bills, yet billions are being spent elsewhere. Lawmakers argue over funding priorities, but retirees continue to feel left behind. What to expect in October? Look at this. What shouldn't be too surprising, it's possible that the exact amount of next year's Social Security Cost of Living Adjustment, COLA, could be a little surprising to some retirees. However, I don't think it should be too surprising. Here's why. The Senior Citizens League, TSCL, has already predicted the 2026 COLA to land around 2.7%. That's only slightly better than the year before, but still nowhere near enough to keep up with true inflation. For many, this feels like a cruel joke. Meanwhile, retirees point out the contradiction. If the U.S. can send billions overseas, why can't more be directed to struggling seniors at home? This has fueled heated debate, especially with Social Security's long-term solvency already in question. Look at this. Retirees must wait another 5.5 weeks, give or take a few days, for the Social Security Administration, SSA, to announce the 2026 COLA. The agency needs inflation data for September 2025 to finalize its calculations. That information should be released by the U.S. Bureau of Labor Statistics in mid-October. The push for a new formula, but here's where the real potential surprise comes in. A growing list of lawmakers, including John Larson, Bernie Sanders, Sherrod Brown, Bill Cassidy, and Senator Kennedy, are pressuring the administration to switch to a new formula for COLA, CPE. Currently, Social Security adjustments are based on CPIW, which tracks the spending of working Americans. But retirees don't spend like workers. Seniors spend far more on housing, prescriptions, and healthcare. That's why CPIW is considered outdated and unfair. CPI, the Consumer Price Index for the elderly, would focus specifically on seniors' spending habits. That means the annual COLA would reflect what retirees actually pay out of pocket, not what workers spend. Here's the exciting part. Analysts estimate this switch could add $300 to $500 per month to seniors' checks. While some dismiss that as unrealistic, the truth is that when inflation is measured properly, the difference is striking. For many, this wouldn't just be an increase, it would be a lifeline. SSA chief speaks out now. Let's turn to another important update. Social Security chief shares update on plans for major changes. The new SSA commissioner, Bizin Nano, recently revealed plans to overhaul the agency. As part of broader modernization efforts under the Trump administration, he's promising to improve both efficiency and customer service. Right now, the situation is grim. Seniors call SSA and wait on hold for an hour or more, only to be told to reschedule appointments. Others show up in person, wait all day, and are still turned away because of staffing shortages. This isn't just inconvenient. It's exhausting and stressful for seniors who already have enough on their plate. And with 72 million beneficiaries and over 330 million Social Security numbers tied to the agency, the system is overloaded. Lawmakers on both sides, from Elizabeth Warren and Bernie Sanders to Republicans like Bill Cassidy and Senator Kennedy, are calling for serious reform. Even SSA's own leadership admits it's time for a reset. The bottom line? If nothing changes, retirees will continue to suffer through endless delays and underwhelming support, even as billions of dollars flow through the system every month. So now, let me ask you a very important question. If you are someone who currently receives Social Security, SSI, SSDI, veterans benefits, railroad retirement, or survivor benefits, how much of an increase do you really want to see in your monthly check? Think about your rent, your groceries, your medications, and even the rising cost of utilities. Every dollar matters when you are on a fixed income, and the reality is, the current adjustments are simply not keeping pace with the actual expenses that retirees and disabled Americans face every single day. That's why this discussion about switching from the old COLA formula to the new CPI formula is so critical. The CPI would measure the actual spending habits of seniors. It takes into account the higher cost of healthcare, the higher cost of prescription drugs, the rising cost of housing, and all the other basic needs that hit seniors' wallets harder than the working population. And let's be honest, that's where most of your money goes. Now, imagine the difference this could make. Analysts estimate that this switch could mean an additional $300 to $500 every single month in your pocket. Think about what that would mean for you personally. For some, that's enough to cover their entire prescription costs. This is not just a policy change. This is about dignity. This is about fairness. Seniors have worked their entire lives, paying into a system that promised to take care of them in retirement. But right now, many feel like that promise has been broken. And unless voices are raised and action is demanded, the system will continue to shortchange the very people it was designed to protect. That's why I'm asking you directly, if you support this push for CPA and if you believe that seniors deserve this $300 to $500 monthly increase, I want you to stand up and make your voice heard. Leave a comment right now that says, I support $500 increase. By doing this, you're not just typing words, you are showing lawmakers, policymakers, and even the Social Security Administration that the people are paying attention and demanding change. Comment below, share your story if you want, and let's create a wave of voices demanding fairness for America's seniors. Thank you so much for watching and for being part of this community. Your support means the world. Don't forget to hit the like button, share this video with friends and family who also rely on Social Security, and subscribe so we can keep growing this movement together.